nakakos ng mangled left hand. So, ibig sabihin, sabog talaga sa kamay niya. And there are no additional reports of ingestion. Data trends, very clear. Tumataas yung fireworks-related na nangyayari sa bahay. Mostly young boys. And also, passive onlookers. So, yung nanonood, kung kayong lalapit, kung may nagpapaputok. Watching community fireworks as the safest way from a distance, watching from a distance. Parents at saka community leaders are important. I'd like to also insert na yung dalawang hospital na binisita natin, may 10 cases na since we started counting. 11 yan at 9. Dito, 0. Meron lang silang fireworks injury dito on December 17. Yung van na sumabog ng may fireworks. Pero for your information, anong difference? Nasa Quezon City tayo. May ordinance dito. Bawal magpaputok at magbenta sa Quezon City. Pero may community organized fireworks. So nakita niyo yung difference, no? Kung meron na community organized fireworks, wala tayong injury. So dagdagan ko na. So ang total, since nag-umpisa tayo magbilang, December 20 tayo unang nagbilang. December 21. Since December 21, naitala na sa buong bansa, 107. So, breaking ngayon, na-hit na natin yung 100, more than 100 injuries. Hindi ako happy doon. There are 4 out of every 10 cases come from the NCR. So, 41%. So, sa atin yung pinakamarami. Sumunod ang Central Luzon with 12 cases. Ilocos Region with 12 cases. North Sargent with 7. Cagayan Valley with 5. Bicol with 5. Calabarzon with 5. Western Visayas with 5. Karamihan ng yan, 97% happened at home. Mostly males with active involvement. So, ibig sabihin, sila mismo yung nagpaputok ang na-injure. So, the top ranking fireworks as of now, 7 out of 10 are boga. Boga kasi nga, ini-explain sa akin, parang pwedeng homemade siya. Just have a pipe, you will make it. And then, lighter fluid. And then, madaming niya injury doon. So, it's not really recommended. 5-star, yung malaking triangulo. Quitis. Quitis is legal, ha? Pero ang sa quitis is supposed to be area. Isang case natin kapon, sinindihan sa loob ng bahay. May tinamaan na nanonood. So, pwedeng legal, pero hindi mo ginamit ng tama. Piccolo. Piccolo, band na yun kasi ang daming na-point ng bata natin. And then, plap-plap. Yung case natin na-activate kahapon. So, we also have cases of burns from Lucy's, whistle bomb, and 6 out of every 10 cases are illegal. Illegal fireworks. At least mataas yung kultura niya. So, nakita niyo yung mga binisita natin, no? Na-highlight natin yung iba pang injuries. Hindi lang fireworks related. Yung drunk driving, yung alcohol-related motor vehicle crash sa Jose Reyes. Tapos yung violence sa Tondo. When we went to Tondo Medical, pag tumataas pala ang inuman, nagdoble from 19% to 33% yung kanilang cases of stab wound and gunshot wound. Dito sa East Avenue, yung poisoning ang hina-highlight natin. Methanol poisoning, so improperly prepared lang pa yun. So these are things that can happen during our celebration. Tomorrow, bibisita pa tayo sa Las Piñas General Hospital and Satellite Center, sa Pasig City General Hospital, sa Philippine General Hospital. And nakasama natin doon si Undersecretary Tayan and Regional Director Arnel Tacson.
Thank you very much, Secretary Herbosa, for sharing with us the latest FWRI cases. Now, without further ado, the floor is now officially open for the Q&A portion. But may I ask our media friends that before raising your questions, please kindly state your name and broadcast agents. For the first question, Sir JC Kosikov from TV5.
Hi, sir. I understand yung mga hospitals are currently under cold white alert status until January 4, but based dun sa ikot niyo, sir, dun sa 3 hospitals, ready na ba itong mga ito?
Based on what we saw, no, they're actually ready and I'm very happy. Accountants are all prepared. Nakita nyo, may setup sila separate. So, sa related, the time that can straight from stipulation. Ginawa sa tondo, yung ground floor lobby ng outpatient department. Yung emergency, dun sa emergency. Kaya yung fireworks related, ilipat nila sa lugar. Ito, nakita niyo yung setup. Ito din ang setup. So this is the setup also for December 31. So ito yung handa.
Tapos, pa-emphasize lang po, kasi yung sa mga ibang nakakainom, yung palusok nila, at ano lang naman yun, isang shot lang, or yung iba sabihin nila pag nag-drive sila, malapit na kabilang kanto lang. Ano bang risk nito? Go ahead, sir.
Nakita niyo yung case kanina, di ba? Yung isang namatay dun sa Reyes he was not drunk, pero tinamaan siya ng isang nakainom. The one that killed him was a truck driver. So very important, different people respond to alcohol detox based on their liver status. May taong isang shot lang, pero nagwawala na. May taong nakasampung shot, pero parang wala nangyari. Meron kaming explanation dyan, medically and physiologically. Pero hindi dapat alam mo kung ano tayo mong inumin. Pagka lasing ka na, huwag ka nang nahawak ng paputok, ng paputok, ng manubela, ng motorsiklo.
Thank you very much, Sir JC and Secretary Herbosa. For the second question, actually this is sent us advanced by Ms. Kat De Villa from Philippine Daily Inquirer. The question is for Secretary Herbosa. Every year, hundreds, if not thousands, of injuries occur from the use of both legal and illegal firecrackers. Will DOA next year lobby for a legislated blanket ban on firecrackers?
That's a very good question. No? As you very well know, fireworks and firecrackers are our tradition to take away the bad luck of the past year and welcome the new year. So it takes, sabi namin sa medicine, merong social determinants of health. If you want behavior to change, you have to look at the agad regulation. So I'm happy there are LGUs like Quezon City that's showing the proof by doing community fireworks. So hindi siya total ban. Pero may community fireworks. Pero zero since December 31. So this is an example. I think Davao is another example. Ban talaga. Pati community fireworks don't ban. Zero din ang injuries. So wala naman the science is there. If you ban it, there will be no injuries. But do you want to ban it? O gusto mong meron pa rin happiness yung mga people by watching community display? So kinausap ko yung mga Amerikano, sa kanila, the fireworks of July 4, yung kanilang Independence Day, they can watch it anywhere from any part. Pero professional licensed people operate the fireworks display. Sana ako yun ang gusto ko, hindi total ban. Still have the benefit of this beautiful fireworks. Di ba nananalo nga ang Philippines sa mga fireworks competition globally? So I think we continue that para hindi rin mawala ng trabaho yung mga gumagawa ng fireworks and then mag-enjoy tayo with yun ang sagutin sa anong gagawin sa fireworks. I think certain solutions happen. Lumga po, Quezon City, yan. May makikita niyo ito.
Thank you very much, Secretary Herbosa. Next question will be coming from Ms. Katrina Son from GMA. All right. Next question from Ms. Kat Domingo of ABS-CBN.
Afternoon, Secretary. When we compare this year's data with last year's data, which is higher po?
Pareho lang. I think I have a figure. Meron ka ba? Meron ka doon table. I wanted to show it. Ay, maliit masyado yun. Now, but we're graphing it also. It's following the same line. Tumaas ng 25, mas umakit na naman by 30. So we follow the same here, it's the same.
What does the data tell us, sir? It's the same, sir.
The same,
Despite the campaign of the government to avoid using firecrackers individually in communities, bakit po hindi nagde-decrease yung number?
Wait, you have to look at it from the bigger picture. I've been practicing medicine for 40 years. So during my time when I was a young resident, we never had these low numbers. 500 cases in PGH alone. We even reach up to 800. Yung kick bucket namin, puno ng daliri yun. So the Iwas Paputok campaign is a success. It's a resounding success if you ask me. There are very few injuries now. Dati, talagang busy-busy ang mga injuries. So, ang perspective ko dyan, it's a big success. This campaign. That's why we keep doing it every year. Because every year, pakunti ng pakunti. Every year, padami ng padami ang local chief executive na gusto community fireworks na lang. So, we're getting there.
Thank you very much, Secretary Barbosa and Ms. Kat. The second question is sent from us in advance. I think this can be answered by both Secretary Barbosa, Arnel, and Dr. Nunez. Sapat ba ang mga gamot at handa ba ang mga doktor natin para gumutin ang mga injury na dulot ng paputok?
Sa gamot and supplies, we have already procured what is needed 1 or 2 months before. So, handa kami. And we have a procurement system to maintain itong mga gamot na ito na laging available sa atin. Hindi lang ito gamot, hindi lang ito gamit, pero yung aming infrastructure ay nakahanda. We have 4 operating rooms available for sudden use ng itong mga victims ng Iwas Paputok. In fact, we have already made some provisions dito sa aming emergency room na dito pa lang kaya na namin i-fix. As far as manpower is concerned, this Abbey Medical Center has 75 personnel on duty. These are made up of doctors, nurses, nursing attendants, nursing aides na mag-duty yan sa emergency room tonight. At meron po kami additional 70 on standby. Ibig sabihin ng standby, dahil kami ay code white, on a moment's notice, pwede silang i-activate at dalhin agad dito sa aming hospital, dito mismo sa emergency. So, yun po yung aming preparedness po sa...
Yes, po.
Thank you, Zito. I'm also happy to see that East Avenue has accumulated modern equipment. All the beds they allocated had a monitor. One panahon ni Dec Velasco, walang monitor. Siya mag-BDP, shared. Tapos may ventilator. Yung e-card, kompleto yung laman. Naalala ko nung araw, yung e-card, pag pinuksan mo, walang laman eh. Yun, kompleto yung laman. So they're very well prepared already. And I think it's the same situation in the other DOH hospitals. I think we can be proud of our public hospitals. Hindi na siya gawa. Madami ng talagang pasyente, pero they have enough supplies and gamit.
Thank you very much po. We are down to the last 2 questions for our press conference. And second to the last question is for Secretary Herbosa. Naka-code white alert ba ang lahat ng ospital sa buong bansa? Ano po ba ang kahulugan ng code white alert?
Okay, so we have several stages. The highest is the code red, no? And code white means standby. When you're looking for a disaster or mass casualty, dapat nakahanda yung teams. Kasi time is life, no? So, nakita niyo yung ginawa nila dito, they have 75 on duty and 75 on standby. Pag nag-code red yan, yung 75 na yun, papupuntahin na, i-recall kung saan man sila. So, they should not actually stay far from the hospital. Ang sa amin sa PGH, 10 minutes. You should be able to be dorm. Naka-dorm pala dito yung 75 na. So talagang standby to actually come here sa hospital in case, let's say, may sumabog na fireworks display and then many are injured. Dadating ka agad dito, madaming patient, madaming doktor din. So, ano lang, ibig sabihin nun, standby, activate, and then slow down.
Thank you very much po, Secretary Herbosa. For our last question, can be answered also by the three of you po. Ano pong mensahe po ninyo para sa mga pamilyang Pilipino sa pag-celebrate nila ng New Year at mensahe din po ninyo sa ating mga LGU and mga community leaders? Ardinalan.
Salamat po. Ang iwas paputok campaign po. We have been doing this for several years. At sinabi ko ni Secretary Bosa that this is a best practice. No? And for this year, we are advocating for three things. No? Three themes ng ating kampanya. Healthy handaan, healthy celebration, at yung iwas paputok. Yung pinag-usapan natin kanina, yung relationship ng mga alcohol drinking, mga vehicular accidents, connected po yan. So sa healthy handaan, sinasabi natin, everything in moderation, avoid salty and fatty foods, avoid alcohol. Alam na natin yung relasyon ng yung connection ng vehicular accidents, the incidents of vehicular accidents to alcohol ingestion. At yung healthy celebration, in-advocating po natin na yun nga, it's a season of gift giving, so as much as possible, we give safe and age-appropriate gifts to our children. And dun, at sa iwas paputok po, if I may just add po a little as far as the National Capital Region is concerned, although ang datos po natin last year and this year nationally is almost the same. For the National Capital Region, it is not. So currently, for the period of December 21 to December 30, we already have 41. If you compare it with the same period last year, we only had 3. So we're expecting, if hindi makikinig ang ating sambayanan sa ating panawagan na huwag na sanang sumunod sa ordinansya at huwag na sana magpaputok, tataas pa po ito. So, nakikiusap po kami sa ating mga local government units for the National Capital Region. We are very fortunate, sir. All the 17 LGUs in the NCR have ordinances banning the selling and manufacture of these fireworks. 11 out of the 17 LGUs in NCR, total ban po talaga. So, umaasa po kami na yung maigting ang pag-implement po ng ordinansya ito, even down at the community level. So, healthy handaan, healthy celebrations po, at iwas pa po. Iwas ligtas Christmas.
Maraming salamat po, Arnel or Dr. Nunez.
Para naman doon sa mga hindi makatiis at hindi mapigilan yung kanilang sarili paputok. At kung kayo ay mabibiktima o masusugatan ng paputok, huwag kayong mag-atubiling pumunta sa isang healthcare facility para tingnan ang inyong mga sugat. Kailangan yung healthcare facility ay may sapat na kagamitan, sapat na kakayahan para tingnan ang inyong mga sugat at gamutin. Ang simpleng paputok at simpleng sugat dito ay nakamamatay din. Kaya huwag po kayong magdalawang isip na gamutin ito ng inyong sarili at pumunta sa pinakamalapit na pasilidad para magpagamot. Yun ang po yung mensahe.
Ako naman, ang mensahe ko, tignan niyo itong mga batang doktor dito. Hindi po mag-New Year yan. Magtatrabaho sila. So, gusto ko magpasalamat sa inyo. I want to thank you, Sir Secretary of Health. Paka natin sila. Sila ay hindi mag-New Year. At hindi lang this year yan. Next year, ganun din. Year after that, ganun din. So, talagang nananawagan kami sa ating mga kababayan. Kaya naman may handaan kayo at may nasabugan, dala niyo naman ng lechon at saka fried chicken. So mga doktor dito, baka hindi pa sila kumakain. So pagdating niyo, may dala naman kayong pagkain para maasikaso sila. Happy New Year sa lahat. Maraming salamat.
Maraming salamat po. That sums up the press conference for Iwas Paputok Hospital Preparedness and Response Rounds. Inaanyayahan po ng Department of Health ang ating mga kaibigan sa media para sa ikalawang Iwas Paputok Rounds bukas sa Las Piñas General Hospital and Satellite Trauma Center, Pasig City General Hospital, and Philippine General Hospital. Maraming salamat po and happy New Year.